Hi, it's me again. I just thought I'd share with you a little video about what kinds of things I have found to be really handy after surgery, things that might help you out if you're going to be going through the same kind of surgery. And again, I'm doing a video series documenting my journey through having lumbar fusion surgery. I had a discectomy at L5S1, a laminectomy, and a spinal fusion, and that was done about 12 days ago. And so I just figured I'd add some of the things that are really helping me out at home. Um, since, well, I normally live on my own with my son, but my mom has been here helping me. She stayed with me for the first week every night. And that was more just to be on the safe side. I felt like after about, maybe about the fifth or sixth night that it was okay probably for her to go at night. So it's really good to have somebody with you if you live by yourself for the first little bit. And you can't drive at all. So I won't be able to drive until the 11th, which is like 3.5 weeks post-op. Excuse me, not drive, but even ride in a car, just so you know. It's a little FYI. So you need to have people lined up that can help you with groceries and errands and getting the kids here and there and paying bills, running to Walmart, all those things that I used to take for granted. So that's one big thing to pass along. And a lot of times, my mom will be in the kitchen when she is here. I'll be in my room. And it is, it takes a couple minutes to get up, get your brace on, to get out of bed. It's doable, certainly. But if you don't want to make 100 trips back and forth, this is one thing that comes in handy. A bell. Hello? I need help. And really, that's not just for the the little items, but more like if you were to have a fall or something. And anyway, a bell is a good thing to have, just so you know. The other thing I wanted to show you is, have you seen these grabbers? Here's the handle end of it. And it's an extension, basically, so that if you drop something on the ground, you squeeze the handle end, and you can reach down and pick stuff up. And I just found out this morning I had dropped a pen, and you do not want to bend over to try to get stuff off the floor. Just don't do it. How about that? So on the end of this thing, there's a handy little magnet. So I reached down this morning to get my pen, and the magnet got it for me. So definitely need a grabber. The other thing, as you can probably see behind me, I have my bed is on risers, and that's another thing I wanted to point out, and I did in my other videos, but it helps tremendously not to have to push up and down from such a low position, especially if you're tall like me. I'm 5'9". So I have a windowsill right here behind me, and this is where I keep all the remotes and the phones. So I have 2 TV remotes, I have a cell phone, I have a home phone, and I have a fan remote. And because, I don't know about you, but I tend to keep my remotes piled up in bed with me, and then you try to flip over and you pick up the covers and they go flying onto the floor, and that's a real hassle. So if you can either get a basket or some handy place to pile all the remotes, that's great too. And speaking of baskets, over next to my bed over here, behind me, I have a little basket with snacks to take medications with, because I take Advil, and you don't want to take that on an empty stomach. And sometimes the pain medication too, it's nice to have food in your stomach. So I have like Fiber One bars, Rice Krispie treats, some little wrapped something or others that you can just keep at the bedside. Then you start to have wrappers that pile up, and you don't want to try to hit the trash can on the floor and miss and then have trash on the floor. So what I have here is I just have a little Pyrex bowl, little mixing bowl, and I put my wrappers in there, and a couple times a day I just grab them all at once and take them to the kitchen trash. What else? Oh my goodness. You have to have a stool softener, and I'm just going to say it like it is, but that pain medication is constipating. And in my other videos, I mentioned that I'm a nurse, and now I'm getting to experience all these fun things that I've seen my patients experience for the last 19 years. Well, yes, indeed, folks, the pain medications are constipating, and I don't just mean a little, I mean miserably. And so definitely drink lots of fluids, take a softener, like I'm taking Cinecot S, which has a softener and a mild little laxative. I'm taking that twice a day, morning and night. And a couple days ago, I had to increase it to 2 tablets 2 times a day. It's just miserable. It's unbelievable. So I had to add that because when they tell you to do that, they're not kidding. Let's see. Oh, and the other thing I wanted to tell you is that next to my bed, I have big old dressers. You can kind of see one behind me, and they've got these big drawers, and they kind of get sticky, and you don't really want to fight with drawers or bending over to try to get in your dresser or bending over to reach your shoes or anything like that. So I got a large size basket and put a few pairs of underwear, and for me these loose fitting tank tops are the most comfortable because you have to have something on between your skin and your brace. So the loose fitting tank tops are great, and then I put a couple of loose fitting capris and like muumuus. I have a house coat, so if I'm wearing a tank top and underwear and I need to open my side door to let the dog out, I'll put on a muumuu so the neighbors don't get a shock. So it's really handy to have a basket of comfy stuff right at, waist level. So you're not having to reach up, you're not having to pull, you're not having to bend over. The stuff you want to wear is right there. And then I just keep a pile right next to it of the dirty stuff so that when I have someone helping here, they know the dirty clothes are right here in this pile. And when they come back to me as clean, I just stick them right there in the basket. And likewise, it's great to have your shoes up off the floor. I have a little, like a little tiny bookshelf or a couple shelf bookshelf, and it's about, I don't know, about 3 feet wide. And on the second shelf up, that's where on the bottom shelf I'll slip my shoes on and off, and then the second shelf up is where I can have them also so that I can reach them without having to bend. And basically with the brace on, you're not bending over, you're squatting with your knees. So before surgery, if you what I did is I put the brace on, and I went around just doing basic day-to-day things to see what it was like to try to do your day-to-day things without bending, which I didn't do a lot of before surgery because there was so much pain, but it's a whole different thing after surgery. So those are some of the things that I have found to be helpful for me. I'm just looking at my notes here. Yeah, the elevated bed, the basket of goodies next to the bed to take the meds with, a stool softener, definitely, a basket of comfy, loose-fitting clothes at reachable level, your little grabber, your bell for help, your remotes and your phones in reach, and a trash bowl. And what the heck does this say? Oh, the last thing is some, like when you do have somebody to come over and help, one of the things that they can do that's really nice is to make up some little sandwiches to put in the fridge and have little convenient sized drinks so that when you do get up and walk into the kitchen, it's not like you have to stand there and do a bunch of food preparation. So I have a stack of little sandwiches in the fridge. I can grab one. I can grab a little size V8 to try to get some nutrition. Little bags of like celery sticks, carrot sticks, cut up apples, just a prepared salad without the dressing. And then she put little individual servings of dressing, so I can grab celery sticks and dressing, or the salad and the dressing and a drink, and I can just grab that and walk back into my room, because what I found is that sitting up is just not comfortable. It's more comfortable to be on my side. I can sit up for a little bit, but not too long. So it's good to have handy snacks too, and someone to help. So I hope this was helpful, and good luck with your surgery.